Hello, I am Dr. Harish. I am a medical oncologist. I deal with the treatment of cancers. So, November month is recognized as an awareness month for lung cancer. On this occasion, I would like to share a few things about lung cancer. It's for general public awareness. So, basically lung cancer is a type of cancer which obviously arises from lung. As all of you must be aware, one of the most common symptom is cough, which does not go away for long time. Most of the patients present with this complaint that there is a cough which is not going away beyond 2 to 3 weeks. Usually this is associated with some sort of blood in the sputum or weight loss or chest pain or breathlessness, usually in advanced stages. Why we need to be aware of lung cancer is because it is one of the most common cancers which we see in nowadays, and the incidence of lung cancer is increasing due to various reasons. The single and most common reason why we do see lung cancer is because of smoking. Almost 50% of all the lung cancers that we see are current or ex-smokers. So, if we stop smoking, we approximately reduce the chance of getting lung cancer by 50%, and the longer we stop smoking, the risks continue to go down. So, someone perhaps who is stopped smoking 1 year back has almost 50% reduced risk as compared to the person who is still actively smoking. So, there is never late time to stop smoking. So, that is one of the important message I would like to give. Smoking does cause cancer, it is not just an advertisement. It does really change the patients and their near and dear ones' family lives for a long time. So, my suggestion, or what you can say is advice or a reiteration of what you people already know, please stop smoking. If I would suggest, even if some of your near and dear ones, if they are smokers, I would suggest that you take the message seriously that we need to stop smoking. In the world today, if everyone stops smoking, within next 1 year we would see almost 50% drop in the incidence of lung cancers. So, one of the most important risk factor is smoking. Please stop smoking. Now, then coming to another 50%, as I told, almost half of the lung cancer patients are current or active or ex-smokers, and especially this is more common in Asian countries, India and China mostly. 50% of all the lung cancer patients are non-smokers. Now, many patients come and ask me, why did they get lung cancer? They have never smoked, they do not even have exposure to second-hand smoke. So, the proposed theory, the next most common cause of lung cancer here is air pollution. There is nothing much we can do at an individual level except wear masks, especially when we are in a heavy traffic zones or near construction activities is going on. That is one thing we can do. As much as possible, try to keep our environment dust free. It's difficult at a personal level, but at a governmental level or a state level, I think we should recognize that the most common and more increasing lung cancers that we see nowadays is related to air pollution, and especially in most urban areas of India and other emerging nations like China. The second most common cause of lung cancer is air pollution, and so we need to be aware that these two are the most common reasons for development of lung cancer. The one thing which is definitely in our hand is to stop smoking. The second one is to reduce or eliminate the exposure to dust, which usually, if it is a chronic level, a single episode of dust exposure does not cause cancer, but over a period of years, repeated exposure to air pollution is one of the major risk factor for development of lung cancer. As I have already told, breathlessness, cough which does not go away for 2 to 3 months, there is a cough which is tinged with a small amount of blood, and weight loss, loss of appetite. These are the signs or symptoms of lung cancer that we do see on an everyday basis. So, if you have any of your near and dear ones whose cough you are seeing which is not going away for 2 to 3 weeks is a big red flag, and I think that is the time when we need to evaluate whether the patient has got a lung cancer or not. And usually it is not that only old people who are beyond 60 do develop lung cancers. Nowadays we do see lung cancers as early as around 35 to 40 years of age also, especially the non-smoking associated lung cancers are seen in an early age around 35 to 45. So, the lung cancers which we do typically see from air pollution occurs earlier than what we see in non-smokers. So, that is one thing. Now, there is a myth even among doctors, not only in the general public, that lung cancer is a dangerous disease, lung cancer means it is a death sentence, and so that is a common belief. You might have seen many even film actors who have had lung cancer and who have bounced back to their normal life activities. Yes, lung cancer is a serious disease, it is not like some simple cough and cold. Nevertheless, there has been a tremendous advancement in the treatment of lung cancers. Many lung cancers, especially those with certain genetic mutations, we treat just by giving simple tablets, like how patients take a tablet for hypertension or diabetes. There are different targetable medications which are tablets. Also, there are newer treatments like immunotherapy and precision guided medicines which have improved the survival of lung cancer patients. And in fact, we may not even appreciate many of the patients who are otherwise incurable disease are now living disease free and for a long duration of time, with many patients even having a cure, which was not seen 20 to 30 years back. So, the diagnosis of lung cancer, it is not an end of the world or end of hope. In fact, in our career level only, we have seen such a nice improvement in the treatment, and we have cured many more patients which would not have been otherwise cured few years back. So, as the science is evolving, the treatment of lung cancer has undergone tremendous changes, and more, in fact millions of people are now walking on earth, otherwise they are symptom free just by taking few tablets or few injections. So, what I would like to say here is lung cancer is a serious diagnosis, agree, but the treatment has improved a lot and many patients are getting cured even after a diagnosis of lung cancer. So, it is not like the end of the world, but definitely we need to be aware that there is something called like this disease, and one of the major challenge here is to diagnose early. So, if you are able to diagnose early, there is a very high chance of cure in lung cancer. So, the reason for making this video is to be aware that there is something called lung cancer, and any symptom related to lungs like cough, breathlessness or blood tinged sputum which is persisting beyond 2 to 3 weeks, we need to seek advice on and if we are able to detect something very early, then there is a cure also. Even in late stages there is a chance of cure, but the chance is less than what we see if we detect the disease at an earlier stage. That is about one thing. Then for normal people who are otherwise smokers, if they are aged 50 and they have been smoking for around 10 years or more, we would suggest them to get a screening CT scan, which we call it as a low dose CT. There is a radiation dose is minimal, and we screen them for a lung cancer even if they do not have symptoms. So, this helps us in identifying the disease before developing symptoms, and we have seen many patients getting cured after getting a screening CT scan with a low dose CT. So, if someone is smoking for a long time, I would suggest them to get screened with the low dose CT scan, and it is a disease for which there is which is having very good survival rates, and I think we should not be worried about the treatment part, but definitely whenever there is a symptom we need to get an early opinion. So, with this I would like to conclude. Thank you.